When choosing a program for your child's liver transplant, you should ask the providers what the follow-up and long-term care look like. It's important that programs follow patients for the duration of their childhood and set them up for success as adults.
After transplant, most of our patients are in the hospital on average about 2 weeks.
We have a really phenomenal intensive care unit here at Children's Hospital. We've tried to develop a multidisciplinary team. We make rounds together every day, surgical and medical, to make clear decisions together, and we invite the families to join us. So while we're making the decisions, the families are hearing what we have to say and what we're planning for that day. One of the things that we've established here that I think is fairly unique is what we call a rooming in process. So the day or two before discharge, the family stays here in the hospital and pretends like they're at home, and so administers the medication and kind of acts like this is what it's going to be like when we get there. That way, if there's any stumbling blocks, we kind of catch them while they're in the hospital so that we know that when they go home that they've kind of had a rehearsal, and we hope that that makes them more comfortable when they go home.
When they go home, we keep a pretty careful eye on them. The visits are very intense and frequent at the beginning and then spread out significantly. Patients who come from great distances, we often partner with their local pediatricians and local gastroenterologists to keep as much of the care at home as we can, and then act as a referral, and that depends on the family and their situation.
The first 2 weeks that we were home, we returned every other day for blood draws. We saw them a lot, and that's how that relationship really started to form. They're just so kind at the appointments, and they're here for you, and they are rooting for you just as much as every other patient that they have. I look forward to going to Children's for appointments.